Hi, I'm Eric Schaefer. I'm in BSN 225, Section 11. Today we're going to be demonstrating drawing up insulin. So we have an order for our patient, Mr. Smith. The order states to give Mr. Smith insulin prior to breakfast every morning. His order states to give him regular or short-acting insulin at 4 units and NPH or intermediate-acting insulin at 8 units prior to breakfast every morning. So we have our order. We're going to go ahead and verify our 6 rights. We want to make sure that we have the right patient, right medication, right dose, right route, right time, and then, of course, the right documentation. We're going to go ahead and verify this order in the MAR prior to grabbing our medication. So we're looking in the MAR, making sure that we have the right medication and the right dose. Once we've verified our order, we're going to go ahead and grab our medication and grab our supplies. So I've grabbed our medication. We have, again, the regular short-acting insulin. We have the NPH or intermediate-acting insulin. I've got alcohol wipes to clean the tops of the vials when we open them. I've got a insulin syringe, a 100-unit insulin syringe. I've got hand sanitizer for hand hygiene, and I've got gloves to apply when preparing our medication. So I've gathered all my supplies. We're going to go ahead and go over to our patient room. We're going to knock on the door. Mr. Smith, I'm Eric. I'm your nurse. I'm here to give you your insulin before breakfast. Patient has responded and has given us permission to come in. So we're going to go ahead and enter the room. We're going to go ahead and close the door behind us for privacy, and then again explain to the patient that we're there to give him his insulin. After doing this and entering the room, we're going to go ahead and verify the patient. So we want to check 2 identifiers. So we're going to ask Mr. Smith to state his full name and date of birth. While doing this, we're going to go ahead and check his armband. We want to verify that the information is correct. So we're looking at the armband. The information is correct. We verified our patient, so we're going to proceed and explain what we're doing. So we're here to administer your insulin prior to breakfast. We want to explain the intended action, side effects, and adverse effects. Also, I wanted to explain to the patient that when giving the injection, we're giving a subcutaneous injection. When doing this, this may cause a slight burning or stinging sensation. This is normal and this should subside shortly. We're going to explain that we're giving you insulin this morning for breakfast. Giving you insulin before breakfast. We're doing this because of your history of diabetes. Because of diabetes, your body doesn't have the ability to produce insulin normally. Insulin is used to convert glucose to glycogen. It does this, we're giving you the insulin to prevent buildup of excessive glucose in the bloodstream, which will cause symptoms of hyperglycemia. So we've explained the intended action. We want to go over side effects. So side effects of giving this medication could, again, also, like I said before, include a burning or stinging sensation. It can involve itching or redness of the skin after the injection. It can involve bruising. It can involve bleeding after the injection. These are all normal side effects. They should go away shortly. We also want to go over adverse effects. So adverse effects are going to include hypoglycemia. So we want to explain to Mr. Smith if he experiences any symptoms of hypoglycemia, he needs to notify us immediately. So things that he wants to pay attention to are going to be disorientation, confusion, excessive sweating, rapid breathing, irregular heartbeat. He could experience excessive thirst, excessive hunger. If he experiences any of these symptoms of hypoglycemia, he needs to notify us immediately. After we've gone over this, we want to ask Mr. Smith if he has any questions. If he doesn't have any questions, we'll go ahead and proceed. So he has no questions. We're going to go ahead and proceed. So we're going to go ahead and start preparing our medication. Prior to doing this, we're going to go ahead and pull up our MAR on the computer and verify our order. So again, we have an order for 4 units of regular insulin and 8 units of the NPH intermediate acting insulin. So we're going to go ahead and check our label. We want to make sure we have the right medication. We want to check and make sure that the expiration date, that the medication is still good. And it is. So we're checking both vials. And we're going to go ahead and apply hand hygiene. So we're going to go ahead and use a hand sanitizer on our hands. We're going to put on a pair of clean gloves. Also, I should add at this moment, as we're putting on our gloves, one thing we want to do prior to giving our insulin is check our patient's BGL, blood glucose level. So to do this, we would do a finger stick with our gloves on, of course. We're going to do a finger stick. We're going to use a glucometer to check our patient's blood glucose level, which we just checked, and our patient's blood glucose level is at a 163. So our patient is not hypoglycemic. There's no contraindication to giving the insulin at this moment. So at this time, we would go ahead and remove our gloves. We would document our patient's blood glucose level at 163 prior to administering the insulin. And then we would then go ahead and reapply hand hygiene and put on a new pair of gloves. So we've already done all of this. We're going to go ahead and start preparing our insulin. So we want to take our vials. We want to mix them thoroughly. To do so, we're going to roll them back and forth between our hands. So once we've mixed our medication thoroughly, we're going to go ahead and remove the tops of our vials. We're going to dispose the tops in the trash. Then we're going to go ahead and thoroughly clean the tops of the vials. So we're going to take an alcohol wipe and we're going to go ahead and thoroughly scrub the tops of the vials with alcohol. We're going to set that aside to dry. We're going to go ahead and open up a new alcohol wipe. And we're going to take our regular short-acting insulin and we're going to go ahead and thoroughly clean the top of our vial. And we're going to go ahead and set that aside. We'll go ahead and dispose of our alcohol wipe. We then want to grab our insulin syringe. So we've got our 100 unit insulin syringe. We're going to go ahead and open that, remove that from the packaging, toss the packaging in the trash. And then we want to inject air into each of our vials. So we want to start with our insulin that we're going to be drawing up second, which is going to be our NPH, intermediate acting insulin. With the cap still on, we want to draw this up to the prescribed dose. So we're going to go ahead and to our MAR, we're going to check our orders again, and our order states that we're giving 8 units. So we want to pull back on the plunger to the 8 unit mark. And if you can see this on the camera here, it's actually a little hard to get that on the camera, but at the 8 unit mark, we're going to go ahead and pick up our vial. We're going to remove the cap. Without touching the needle, we're going to insert the needle directly into the vial of NPH. Without touching the medication, we want to expel the air in our syringe into the vial, and we want to remove the needle from the vial and set it aside. We're then going to go back into our MAR. We want to check the ordered dose of regular insulin, which is going to be 4 units. So we're going to go ahead and pull back the plunger on our syringe to the 4 unit mark, which if you can see, a little hard to see, but it's at the 4 unit mark there. We're going to go ahead and pick up our regular short-acting insulin. We want to stick our needle into the vial and we want to expel the 4 units of air into our vial. We then want to invert our vial and we want to pull the plunger back to the 4 unit mark. We're going to remove the needle from the vial and set that vial aside. And then we want to look for any air bubbles and we want to flick those air bubbles to the top, positioning the plunger back to the 4-unit mark. We then want to pick up our NPH, intermediate acting insulin. We want to stick our needle into the vial, and we want to invert the vial, and we want to pull back the plunger without overdrawing our medication to the total prescribed dose of 12 units. So we've got our total prescribed dose of 12 units. We've got 4 units of regular insulin and 8 units of NPH. If you can see there, we're at 12 units. We would, of course, want to verify this with another RN, make sure that we have the right dose. So we would ask another RN nearby to just verify that we have the right dose that's prescribed with our order. So we'd pull up our MAR and we'd have the nurse look at the MAR and then, of course, verify the syringe and make sure that we have the right prescribed dose for our patient. If we were at the nursing stand, we would want to make sure that we label this prior to bringing it to our patient's room. So we're going to put a label on it that says our patient's name, the drug that we're giving, the dose, the date, the time, and then we would, of course, initial as the RN who drew the medication. We would also want to make sure that we did not walk to our patient's room with an exposed needle. So we would never recap a needle, but in this situation, we would want to make sure that we use the one-handed swoop technique to recap our needle prior to going over to our patient's room. We are at the bedside with our patient. We drew up our medication bedside, so therefore we do not need to label our syringe, and we do not need to recap our syringe. Again, we would never recap it unless we needed to walk to the patient's room. And again, we would only use the one-handed swoop technique to recap our needle. So we would administer our insulin subcutaneously to the patient for a total prescribed dose of 12 units. Again, that's 4 short-acting, 8 intermediate NPH insulin. After we've administered it, we would engage our safety device. We would dispose of our needle in a sharps container. And then we would ask our patient if he has any questions or if he needs anything. If he didn't have any questions or didn't need anything, we would see if he needed to be repositioned in a position of comfort, place his call light within reach, and then we would go ahead and remove our gloves. We would apply hand hygiene, and then we would excuse ourselves from the room, and we would go ahead and document that we gave insulin to our patient.